You're watching Talk with Audrey. Welcome back. Prescription drug coverage is the most frequently used benefit that employers and health plans offer, but most people don't know how to make the most out of their prescription drug coverage to get the most value out of their benefit. Dr. Christine Gilroy is Chief Medical Officer for Express Scripts, one of the largest pharmacy benefit managers, and she has information today about what you should know before heading to the pharmacy to fill a prescription and what to look for when shopping for coverage at the next opportunity. Welcome.
Thank you, Audrey.
Thanks for joining me. What are some of the challenges that people experience when filling their prescriptions?
The biggest challenges that we see for people in filling their prescriptions is first affordability. So combined with inflation and drug manufacturers raising their prices, Americans are paying more out of pocket than ever, and it's really inhibiting their ability to take their medications as prescribed. The other issue we see is around accessing their medications. If they're in a rural area, a pharmacy might be far away, or even in an urban area, it can be difficult to find the time to step away from work or family obligations to make sure that you can fill your prescriptions on time.
And what about the cost? If pharmaceuticals are raising their prices, a lot of people are not going to be able to afford their medication, so they're not going to take it as prescribed. What can people do to keep their costs manageable?
So our observation has been that when a patient has to pay $50 or more out of their pocket for a prescription, the likelihood that they won't pick that prescription up and take it home is 4 times higher. That's why we have come out with a program called Copay Assurance to help patients know that the prescription that they get, if it's a generic, it's going to be $5. If it's a preferred brand, it's going to be $25. And even for specialty medications, it will be just $45. And those copays apply immediately. They don't have to wait for their deductible to be spent before they can access affordable medications.
Okay, that's news.
We had a lot of experience. So in 2019, we were the first company to come out with capped insulin copays. We had really seen that as the insulin prices were being increased by the manufacturer, that people were filling their insulin less frequently. And we felt it was incumbent on us to negotiate a cap for that insulin to help people be able to afford to continue to take it. And in just 2 years, we saved consumers $45 million. What we see right now is that adherence again is decreasing as copays have gone up, and it's incumbent on us to step forward and offer these cap copay programs to make sure that we're really delivering the best health and service to all of our clients. With Express Scripts and your plan sponsor, generic drugs would be available for $5 per month. Preferred brand medication would be available for $25 a month. And specialty preferred medication would be available for $45 a month.
Oh, thank you. That's huge. And it's going to be a real benefit for people who are struggling. Doctor, what should people look for if they're thinking about shopping for a new prescription drug plan?
So I think really looking for what the out-of-pocket costs are for your medications is incredibly important. Most individuals are not shopping independently though, right? They're working to get their plans through their employer. And it's really important to also talk with your employer benefits manager to help them understand the importance of having those affordable medication and how it impacts your ability to be present at work and also present with your family.
All right. Whew, guys, that's a lot of great information. As I always say, informed is empowered, and holding the line when it comes to the cost of your prescription medication is really important. Doctor, where can we go for more information?
So you can find more information about this program at evernorth.com/affordable for all.
Dr. Gilroy, thank you so very much for joining me.
Thank you, Audrey. It's been a pleasure.